Hi, I'm Patricia Greenberg. My guest today is Dow Stick. She is a nurse practitioner, a person who takes very good care of older people and knows a lot about it. I think that's probably the best way I'm going to describe this. And lately it's like all we seem to talk about today is getting older. What do we do about it? Aging is not a disease or something that should be avoided. And I always like to say anti-aging it's a connotation, it's a movement, and that's really to just to erase the signs of aging and pretend that we're not aging. 50 is the new 30. This catchphrase is being thrown around by that cohort, the tail end of the baby boomers, people in their 50s and 60s now. I personally love that I'm aging. I feel the world has so much to offer, and I'm much more open to what comes my way now as I get older. I've learned I've nothing to lose by taking chances, putting myself out there. And really one of the things that I want to do and why I brought Dow in today and some of the other people is that we collectively can open up this conversation about our attitude towards aging in order to change our collective perception about this wonderful stage in life that can and should, without a doubt, be our best years. Dow, I want to welcome you to the show.
Thank you for having me, and thank you for this important work that you're
Yes,
highlighting.
yes. And again, I mentioned you're a nurse practitioner with an
Correct.
advanced practice, and you also are a freelance writer specializing in issues concerning older adults. So
Correct.
tell us a little bit about your work.
Thank you.
Mhm.
Well, I've been a registered nurse since 2002, and it was many years before I became a nurse practitioner. And throughout my work, I was inspired to work specifically with older adults. And I think that came from a background of having parents that taught me how important it is to be with my grandparents and with older adults who have stories and wisdom to share that it's best if we all learn from, I guess, so history doesn't repeat itself, but also there's such beauty in story, right? That's what we all connect through, and how important words are, and just listening and being respectful of those people in my family. And I realized maybe earlier on than some that one day, if I'm lucky enough, I'll be this age.
Mhm.
And how would I want to be treated? And as a nurse, that became particularly important as I saw how some of my patients were treated, how I was sometimes, because of lack of time, wanting to rush through or speak over them, uh, people who are older, and just realizing that it's an honor to be a nurse, um, because of the vulnerability you're allowed to witness when someone is ill, or no matter what their age is. But then when I became a nurse practitioner, realizing what it really means to partner with people
Yeah.
in later life and let them tell me which way care is going to go, what they're open to, what they're not. And I just feel so lucky to be where I am in my practice. I began freelance writing and noticed through some of my assignments that the language that I was being asked to use
Mm.
maybe wasn't what we use in medicine, and I started doing a little bit of research about what is recommended by the bodies that I follow. And I think that's how you and I connected in this work, and wanting to be more collaborative, more open, more inclusive, more loving, because we're all in this boat together. It's something that we share. Is nobody escapes getting older unless you die younger.
It's interesting you talk about the respect for your parents and your grandparents. We all had that, and there was a certain point in society where that shifted, where people stopped respecting older people. Do you see in hospitals and healthcare facilities, like, was that something you saw on the front lines that somebody was dismissed just based on their age?
That's a great question. I was trying to think of some stories uh, that really changed my practice, and I couldn't come up with anything specific. Um, One story. I think what happens is these micro aggression. I don't even know if they're aggressive, but these micro events which build up over time, and we all adopt because of the pressure in medicine to move things forward, to make decisions. We're pushed by insurance companies, by big pharma, to do things a certain way at a certain rate, to be paid a certain amount. And so, as you know, with age or with chronic illness, not that the majority of older people are ill, but illness tends to occur more often later in life. It can be harder to make decisions. It can be harder when you've been an independent individual to make decisions,
Mhm.
especially in when you're not feeling well, when you don't want to be a burden to your family. And so, what I would say that I have seen the most is we don't make eye contact appropriately with the patient who's older. We speak for them, we finish their sentences, we talk over them. If they have a caregiver or a spouse, especially if that spouse is male and the patient is female, we talk to them. So it's these things that are disrespectful, and also non-inclusive, and that I see as problematic. And again, I don't know that there was a cultural shift. I think, how women particularly are treated in the media and how we're supposed to maintain certain youth and
Sure.
beauty. That's another conversation. But I just think older adults, because there are more of us with the baby boomers
Yeah.
aging out in the next 10
Mhm.
years, reaching age 65 and older, I think there are just more older adults, and how we are approaching them, it can't be the same. It's not the same for everyone. How we treat and talk to patients. So we can do better there. And
Oh,
that's what I
yeah,
see.
yeah, yeah. That needs to change. Which brings me to and it's not a trick question, Dow. It's something just that
Okay.
we're talking about is, at what age are we considered old, elderly, or not no longer young? There's this age is just a number, but it really isn't. It's how old you are is important.
Well, it
I mean, your
is.
chronological age, your number, I think it's very important for your well-being and the care that you get to be honest and open about your age.
I agree with you.
Mhm.
And again, how our society is set up through insurance companies, Medicare, you know, age 65 seems to
Mhm.
be the most
Mhm.
popular. I
Mhm.
think the Health Organization says 60.
Okay.
Um, when I talk to patients, friends who are older, I think it really depends on the person, and their perspective. I've known 50-year-olds who, just their vitality is much lower than people 20 years older than they are,
Yeah.
who feel old. They'll use that word. Um, and then we have to realize that we are very fortunate in America for the most part, that we're a well-developed country. We do have healthcare. No, it's not accessible to all people, but in sub-Saharan Africa, older is considered age 50. Their life expectancy is different. So I think it's important to say that.
That's a very, very important distinction. We all have that stereotype in our minds about an older adult. It's a terrible image. They're frail, inactive, grumpy, not productive members of society. And with all the information we have out there now, that's still pervasive. So again, collectively, I always like to say I partner with my guests so we can, kind of discuss this together. Is that, defining ageism and just introducing some of the ways that it affects all of us. It's a stereotyping and it's just discrimination based on a person's age. And it seems like we experience it everyone experiences it sometime. But what's so tragic to me is like exactly what you were saying. Someone will say, I'm too old to, or I'm an
Mhm.
old person now, or I'm not being paid attention to because I'm older, or older people aren't supposed to do that, or act your age. I think unfortunately, like you mentioned, when people are compromised, where they're not feeling well, or they're hospitalized, or they have an illness, I would imagine that's exacerbated.
Yeah, I thank you for that.
Yeah.
And I think that I think people get married to their story.
Hmm.
And I think there's enough in our medical culture anyway for people to become what their illness is, become what they see in the media, and it's a way of getting attention,
Okay.
right? Because it's out there and it's the
Right.
way it works. I think it's harder to challenge the status quo,
Hmm.
and so presenting yourself as uh, well, even if you do have a diagnosis or you do have a physical disability that you're living with, I think it can be more challenging. And again, it depends on the person. So I think it depends on how you want to approach life, how you want to be perceived, and how what is meaningful to you regarding a quality of life. And if it's for people to listen to you and engage with you, and the only way you know how to do that is to talk about, I'm older, I can't do this anymore, instead of saying, I don't want to do this. Like, I'd
Yeah.
rather do that.
Yeah.
This is
Yeah.
what really, butters my bread.
Yes.
I think that's just something people have to be open to and look at, or not. We're lucky we have choices.
I again, when we had a little discussion offline before we started, we talked about, how pervasive ageism is worldwide. And one of the things that, in my research and, researching the World Health Organization is that there's a narrative, you're 65, like I was mentioning earlier, you're not supposed to, whatever. Ageism also plays a role in society that it boxes people into a segment, a cohort, and says, okay, well, this is what we're going to do with people over 65, and this is what we're going to do with people from 50 to 60. But the young kids, we can draft them, we can send them to war, we can send them out into the workforce, we don't have to pay them so much. Like, this is how pervasive ageism is, because that's where it plays a role in actually someone's running a business. Well, you don't want people over this age, it's not a good look. Or get rid of Joe, who's 65 or 70, because we're paying him a lot of money, and just stick a young kid in there. They can take over, they can learn, and we can cut that salary by a third. No value is held on that person's loyalty or time or expertise or energy. And unfortunately, this still is, as we all well know, very pervasive. And there's ways of eliminating people from your business, firing them, and you can pretend it's not ageism, but there's other reasons to let somebody go. Um, Having said all that, Dow, one of the reasons I sought you out is because you also write about health issues concerning older adults and teach others, the appropriate terminology when discussing older people and elder care. Uh, so really, what are the appropriate terms? I guess that's a big question with a lot of answers. But let's talk about the terminology and why is it so important?
Sure, be happy to answer that. I do want to
Hmm.
go back to something you introduced right before that, and that is what is happening to people in the workforce, and as people, are aging and staying in the workforce longer. Um, and when we overlook and don't listen to our older patients, and the systems suffer. We miss what's really happening with people. We miss their wisdom. We miss their experience. And I found this in a 2021 World Health Organization report that ageism, like you said, when we're just judging somebody based on a physical characteristic, we may not even know how old they are. We're just
Right,
looking at them. um, they're going to have poorer health, social isolation, earlier deaths, and cost economies billions of
right,
dollars.
right.
Because when we don't listen to people, or we chalk something up to just being age, we miss things.
Yeah.
And when we let people go from companies, institutions, nonprofits, whatever it is, we are not valuing. In my opinion, we're not valuing the right things. And when those people are disconnected to meaningful work, when they're not listened to, this is where the sickness comes in. This is where we, people end up unwell and in hospitals, or socially isolated, and things become more problematic.
Right.
In this way, uh, it's important to, when we talk about older adults, whether it's in medicine or outside of that, certain institutions, including the American Medical Association, are saying, let's stop classifying people as old. It's important to look at age in medicine, because of, we prescribe medicines, or
Mhm.
physical therapy, or, something like that. It's what can this person physically do? Again, more, what is that person functionally able to do, more than just based on their age, what do we think they can do? Um, but also, socially speaking, we want to be more inclusive. And this is where this person is in the spectrum of life, right? They are an older adult, or a younger adult, or a middle-aged adult. They're not, when we use senior or geezer or grandpa, I call my grandfather grandpa, but I had a young friend of my spouse call me old lady, just like,
Wow.
oh, that's so and so's old lady, and I know that he was joking, and thought it was cute, but I
Yeah.
didn't like it,
No, I don't blame you. I don't
and a
blame you.
lot of I since you asked me to do this talk with you, I've been asking some of my older friends, does the word senior citizen bother you?
Mhm.
Does the word old bother you? And interestingly, nobody has said absolutely yes. And I don't know, again, if that's, they want to sound, they don't want to sound controversial, or bothered by stuff that's going on. So I don't know where this movement started. If it was in social science or in medicine, I need to read more about that. But
Yeah.
all that to say, we use older adult, we use later life. We try to keep age out of, when I say we, I mean health writers who are talking about older adult health and wellness. If age isn't a factor, why are we mentioning it? Is it
Right.
necessary to the
Right.
story? But using the word old, we're asked to think about staying away from that.
So this is interesting in that we it's just a term. In other words, a little kid, a young adult, an adolescent, a teenager, middle-aged, older adult. These are all acceptable because you're referring to an age range or an age, like, I'm not, if you're 65, I'm going to refer to you as an older adult because that's the definition on the living generations that we know today. And that you're 65 and up, you're an older adult. But now there's got to be considerations in somebody who's 65 and someone who's 90. You can't
Mhm.
group that together either. Um,
That's right.
so
That's
older
right.
adult, older adult, like at some point we have to say this person is in advanced old age.
Yeah. And I think again, we're talking about in written communication, verbal
Mhm.
communication, professional
Yes.
communication. We're trying to be more careful about being more inclusive, and saying, this person is in late life, you know. Um, but I have an 80-year-old friend who asked me to go hike in Spain with her next
Yeah.
year.
Yeah.
And I have relatives that are in their late 60s, early 70s, that couldn't do that.
Oh,
And
yeah.
so I really think we just have to focus more on the person. But you're not wrong, within the profession, within medicine, psychology, nutrition,
Yeah. Yep.
even, I don't know what you would say between the digestive health of a 60-year-old and a 90-year-old, but again, genetics plays such a role there. So
Yes. Yeah.
I would hand that back to you and say, do you see those decades as different?
100%. 100%. At 60, even 70, there are things that can be reversed through good diet and exercise and maybe the proper medications. But managing that or trying to reverse it at 80 or 90 is a whole different ballgame.
Mm,
So separating out the genetics, yes, you still should get up and walk every day and exercise, but you're probably not going to turn that back at 80 or 90. Maybe you can at 60 or 70. You know, it's
That's
interesting you're
interesting.
mentioning
Yeah.
about this too, is I was a long time runner and I switched over to walking, and I still walk at the races that many of my running friends are at. And I have dear friends, I'm 63, and I have dear friends that are late 60s, early 70s, still running marathons every weekend. And I have friends younger than me, like you say, that are really downright infirmed. I mean, they have difficulty getting anywhere. So this is where it becomes individualized medicine, personalized medicine,
Yes.
that the person has to, the individual has to be taken into account. So maybe you'll find that 90-year-old who eats a little bit better and gets up and wow, things are reversed and changed. But as a rule, I think that it's very, very important to distinguish between the older adult, the very older adult, without any kind of disparaging remarks. But do you feel, or do you find or see that nurses coming in, the young men and women who are in their finished nursing school in their 20s, do they have how are they, is there sensitivity training? Are they taught to take care of older adults, or is it just, again, that up to a certain age they're engaged, and then past a certain age they'll just say that's an old person laying in a bed?
I have a lot to say about that.
Yeah.
Um,
Tell me, bring it on.
when I yeah, no, Louise Aronson, who wrote Elderhood, she talks about in medical school how I think they get days
Yeah,
of talk about, and in medicine we still use the word geriatrics.
yeah.
Geriatric is another one of those descriptors we're supposed to turn away from in journalism and writing, but not but and when I was in nursing school in 2000, our first semester of training, we were taken into skilled nursing facilities, what people call nursing homes, but skilled nursing facilities is what we call them. And that's where we learned to give shots.
Hmm.
And that's where we learned to give baths, bed baths. And, we were brand new nursing students. And I will never forget that because and I think it depends on your school and your instructor. She venerated older people and, just took extreme care to show us how to do things. Because I haven't been in nursing school in 24 years, I do have someone I mentor who's in school now, and she showed me her coursework. There's nothing specific to older adults. I'm sure when they do pharmacology and talk about how drugs are processed and metabolized, age comes into it. But drug companies aren't able to do studies on people in late life. Often, it's people into their 70s and that's it. And yet we're prescribing drugs all the time to 80 and 90-year-olds. So um,
Mm.
I think that I lost my track of thought a little bit. I want to make
Okay,
sure I answered your
that's
question
okay.
there.
Yeah. I think we were talking about, are the nurses and health professionals trained
Yes.
uh, to deal with it? Again, you say, they get into their 70s and there's like evidence and things we know about what works through their medication and their treatment. But now we have the advent of all these people not only living longer, but this surge of baby boomers where the bulk of our population is now in a few years going to be 65 and older.
Yeah. So thank you for helping
Yeah.
me.
Yeah.
I think it depends on the program and what they're going to focus on. I think because there's such a nursing shortage, that the focus is on getting the information and getting these folks graduated. I hope I'm wrong.
Yeah.
I hope
Yeah.
there are focus courses. Um, I know in my program as a family nurse practitioner, there was, but as far as nurse aides who actually do the physical care for most adults, I don't know.
I understand that there's a general shortage of physicians going into gerontology. And
Mm,
that's a shame because that's a specialty that, is exploding and is going to need people. So those of you out there listening, going into the medical profession, whether it's medicine, nursing, nutrition, chiropractic, acupuncture, any of these allied health fields, think about that your population, the population in general, is older and aging, and to pay attention. I want to jump back over to something we were talking about, terminology. And I had asked you personally, Dow, about this, the silver tsunami. Why
Mm.
is that considered? I thought that was very clever. I thought that was a brilliant um, term for the onslaught of older Americans that we're going to see now. So tell me why
And
it's,
it is, what a vivid image,
yes, yes.
that produces. But
Mhm.
you think about a tsunami as a destructive storm, and so what was brought to my attention is, how is it to be one of those people on that wave that's making it silver? That you feel like you're crashing down and destroying, infrastructure, or they're not
Interesting.
ready for you. What are they going to do with you? You need to
Mhm.
be put somewhere. There's no one wanting to take care of you. And so, as far as a creative writing perspective, yes,
Yeah.
that was, a win, but not in how it's representing the people.
That's
I
very
don't think.
interesting. It's very enlightening to hear that. It's because you had mentioned when we isolate one another with labels, it's othering, it's making them other people, if we
Yeah,
live,
whatever age we're doing that
yeah,
to.
yeah,
I do it with millennials. I mean, I
yeah,
have my opinions about them, and I
yeah,
realize what I'm doing to them. And we want, uh, speak to the problems of the world here.
yeah.
We want to bring each other closer together over our commonalities instead of separating each other based on how we look different. And I think that's, that othering thing is where that comes from. It leads to discrimination, period. You're different than me, so I don't have to try to identify with you. Or and there's so much fear in getting older because we are treated differently. and
Yes.
and I think nobody wants to identify with getting older. But when I talk poorly of you, if you're older than me, I'm eventually going to be talking that way about myself. And so it just doesn't make a lot of sense.
That's the interesting catch 22 is that people are really quick to make disparaging remarks about older people out of fear that I don't want to be that old person. And you hear people, to me, this is terrible, say terrible things like, if I'm that man on the front porch that can't make it to the bathroom, shoot me, or as soon
Absolutely.
as I, right, or as soon as
Yep.
I don't remember where I'm going, put me away. I mean, these terrible, terrible things that people say in reference to themselves and what they see other people doing. And, the reality of it is, maybe very different than what you think is going to happen to you,
That's
but
exactly right.
right. And that people should have. We've all experienced this, Dow. How many times in your life would be that one person that's just, I don't know, self-destructive and doesn't seem to care, and they live to be 100 and they smoke and drink and don't do anything, and then you have that other person who takes unbelievable care of themselves and are stricken with, disease. So I'm not making it an either or, but you don't know what's going to happen, and I think that the thing is to embrace the world and a little bit more inclusiveness in general is probably a bet. And that's what I was going to ask you. How do we counter some of this ageism and self-ageism? Ageism against oneself.
Yeah. I think a term I was wanting to bring up when you were just now talking is vulnerability. It is hard to put ourselves in a position where we are the vulnerable ones. And so, when we see an older adult who needs help and may or may not want it, is the other thing. Because I've gone to help people who seem like they want a door held and they're like, leave me alone, I've got this, um, is are we willing to identify with what their experience is? Are we willing to consider that it could be ours? I think distancing ourselves from something we're frightened of feels natural, but actually going towards it, experiencing it, helping someone who's already in it is actually really healing.
Yes.
It has been for me.
Yeah.
I have all this information, ideas about how to cope with things because I ask. And so, what does this idea of inclusion mean? Well, I put some questions to your audience. It's like, and your friend group. are they all your age? Do you have older friends? And, you may have family members who are older, and those are the only ones, available to you right now. Well, how often do you talk to them? When
Mhm.
was the last time you showed curiosity about something in their lives, whether current or past? I hear a lot of people complain. My mother always talks about her physical ailments. My dad never reaches out or talks to me. Um, I think he's depressed. And, can you show some curiosity?
Right.
Where can you get involved in your community? So if you're like, well, I don't live in a neighborhood where I see older people, do you know where your local community center is? That a lot of these places are called senior centers, which may or
Yeah.
may not bother you.
That's still the
Um,
right. That's
you
still the
know,
term for it.
but
Right.
they have special programming and social outlets for people in later life. And the one in my town is next to the pool.
Mhm.
So kids and young families go by there all the time, and volunteer programs. Do you have time to volunteer where you're going to meet people of different ages? And then if you're an employer, uh, looking at, are you including, um, older people in your considerations, for funding, for new programs, for keeping them on board longer, especially if they show up and want to work. These are all ways we can look at being more inclusive.
It's so important that you bring that up. And one of the thing is that we're all getting older and we're talking to each other. And I just keep saying we're preaching to the choir here. We're all interacting and talking about what we can do. And one of the best things you could do, I'm reaching out to the listeners, is if you have children or grandchildren, take your grandchildren around older people, maybe just for the
Yes.
day. They have
Yes.
adopt a senior. The seniors can adopt a dog. Bring your dog, bring gifts, just bring a game, interact with older people. You cannot believe what you would learn. The person might tell you a story that changes your whole life, and it's is just being more open about this, and like you say, the community of all ages and having friends of all ages. One of the things I think is important is to have a lot of friends your own age so you can share what it is you're feeling and what you're going through and the shared experiences. Like I love
Yes.
my childhood friends that I'm still friends with from the time some friends I have since I'm literally 3 years old. We all went to K through 12 together. So we all, we have lifelong friendships. And then I have friends I've met later in life, all within different age groups from from late 50s all the way up to 80, and it's interesting to hear people's perspectives and their lives and what they go through and all that, came from different backgrounds or different education levels. It's very, very important, I think, for your own personal growth, just to see what it is out there and to share that. Dale, before we didn't discuss this ahead, but another question that kind of came up for me is
Sure.
what about those nurses and doctors that are still capable of practicing in their 70s, 75, late 70s, even 80? Is that better for the older adult patient to have someone their own age working on them?
I can only speak to this through personal experience.
Okay.
I'm 48,
Hmm.
and I was on a team with two physicians who were mid to late 50s. Um, and we were at a retirement community, a continuing care community, and we would see residents in the assisted living and the skilled nursing facilities. And then there was a clinic for those living independently. And the residents on the campus who wanted to come into the clinic, they would prefer to see an older provider.
Interesting.
So, and again, with that reverse ageism, I
Yeah.
don't know.
Yeah.
They didn't
Yeah.
think that I knew as much. I
Yeah.
hadn't lived as much.
Yeah.
Lived experience matters to me. As I have gotten older, interested in experience as much as I am in your credentials.
Right.
You know, um, and so I don't know that I'm fully answering your question, but there's absolutely space for providers who want to stay in as long as they want, and are with great value.
Yeah.
I would say that what's difficult in my experience in medicine is that it doesn't make a lot of space for you to have enough time to talk to your
Mm.
patients, no matter what their age. But if they have more illnesses or more challenges, or you need to have a family conference because someone, who is getting older is having more problems and needs to transition to more care, there just isn't time in the office. Insurance companies don't pay us for that. And interestingly, I've gotten into direct primary care as a patient, and I'm seeing people of Medicare age who have Medicare, paying for direct primary care, which is concierge medicine, may be something people are more familiar with. But it's fee for service medicine so that their doctor can spend an hour with them
Right.
instead of what's the average doctor's office visit? 7 minutes.
Oh, terrible. Yeah.
Yeah, and I will say it's not the provider's fault. I
Right.
mean, this is what's mandated, um, by external forces. So that's a challenge. One other thing I wanted to mention, Patricia, when we were talking about the decade differences between
Yes.
60s,
Yes.
70s, 80s,
Mhm.
and 90s,
Mhm.
something I wanted to say that one of my mentors taught me, is those people that are living into their 80s and 90s, they've actually survived a lot of the diseases that have ended life for other people. And so when you were talking about reversing conditions, how it's harder in the age set, those people, by lifestyle choices and or
Mhm.
genetics have already, survived a lot of things that have ended life for others. So I
That's
just
a
thought that was
very interesting point. People, more and more people are surviving breast cancer, colon cancer, the things that were once detected very late and not found. Heart disease now, there's all these interventions that people can have not to die. Stroke, if it's addressed quickly enough, the repercussions can be minimized. I didn't think about that a lot of these people might have had one, two, or three or more of those conditions, and
right.
and they
Or they
got to
just
the
had
other
excellent
side.
health because of
Yes,
genetics and they were
yes,
never exposed to it
yes,
and don't have anything to relate it to, like I'm just, my body doesn't work as well as it used to, but I don't have anything seriously wrong with me. May we all be so lucky.
yes, yes.
Um, yeah,
Dad, we always hear about all these diseases that are prevalent among the aging. And of course, what comes up for everybody is the anywhere from slight cognitive decline and memory loss all the way up to Alzheimer's. And that's everybody's fear about it. And what we're finding now, research is showing over and over and over lifestyle choices that we can make to minimize it. And I think what's left out of that equation is how well did you live as a younger person to avoid some of the decline as you get older? You don't think about that when you're younger. Do you see do you see older people taking lifestyle choice changes and it helping?
yes, absolutely.
Okay. So there's hope.
Absolutely.
Yeah.
There is. And I was going to ask you because you're a registered dietitian or were.
Yeah, I was. I'm certified nutritionist, but I still work.
Yeah.
Yeah. Hmm.
Um, so you're the expert as far as food choices, what is a better diet overall. I mean, it really, I'm sure, depends on the person, but something that I really push with patients and loved ones is the importance of exercise.
Hmm.
And not just exercise for the sake of exercise. We have these recommendations. We're supposed to do 150 minutes of moderate, exercise every week and 2 days of strength training. Find something that you love.
Yeah.
And if you don't love like a sport activity or being outdoors, how can you incorporate cardiovascular or strength training into your everyday? There's some senior apartments at the bottom of my street, and there are people who have motorized wheelchairs,
Mhm.
and they are riding up and walking their dogs, in their motorized wheelchair,
On the
which
chair,
is
right.
upper
Hmm.
body mobility. It requires, flexion and extension of their arms. They're enjoying time with their animal. There's something you could take the stairs instead of the elevator at your apartment. And it's hard to change habits, that's a whole nother discussion. But yeah, there are a lot of things that can be done to stay active. I think just staying active is important, but you have to enjoy it.
Oh,
And so
there's
you
no
don't.
question about it. You have to pick
Yeah.
something that makes you happy. Yeah.
Yes.
You're going to hate it. This is why, you go to the cardiologist and they say you have to exercise, you got to get on the treadmill and you got to, and they're hating every minute of it.
Yeah.
So, you know,
Yeah, and with the 7 minutes you have with somebody, you don't have time to dive into what they're, what they enjoy
exactly,
doing.
exactly. It's crazy.
But
So,
yeah, it's true, when I was in my 20s, I wasn't thinking about, "Man, I shouldn't do this. I'm not gonna feel good when I'm you know, in my 70s," but that I don't know, when did that start happening for you? I mean,
what's that? I'm
when
sorry.
did
Was
you
it?
start considering, that your choices were gonna impact your older self, like,
Oh,
physically?
that's a good question. I've been at this for a while because I've been studying it, but I'll tell you, it really about mid 40s.
Yeah. I would say the
About
same
mid
for me,
40s,
maybe
yeah.
even early
Mhm.
40s, yeah.
I started to feel, and you know what it was? I think,
Tell me.
honestly, Dow, and this is a wonderful conversation to bring up. I was succumbing more to what people were saying to me than what I was actually feeling.
Hmm,
I ran the Boston Marathon when I was 54. I
that's awesome.
climbed,
That's
I
awesome.
climbed the World Trade Center
Mm,
2016. I don't know if you know that tower climbing is a sport. And I
it
climbed
should be.
102 stories in the World Trade
Woo!
Center. I climbed
You
the
did
Empire
that?
State, I
Yep.
climbed the Empire State Building, the Aon Building, and United Bank, I think it is in LA, and the Hancock Tower in Chicago. And everywhere I go, I I take the stairs. It's my new insane sport, my new
I
extreme
tried to.
sport.
I tried
And
to too, unless I, have
yeah,
much luggage.
and I will tell you something that's very profound because we're getting near time, and I really want to share this, is that um, I had a hip replacement 14 weeks ago. I'm right at my 14 weeks. I'm doing great. I'm exercising. I'm eating well. But I have to tell you, that totally changed my perspective. I'm a nutritionist. I'm certified as a trainer. I'm a wellness educator. This is all I talk about and write books.
Yes.
And
Yes.
I now am embracing gentle fitness. It is my
Good.
new mantra, is that
Good.
I'm going for a walk. I'm going to take pictures of flowers. I'm going to take my monster puppy Labrador retriever up and down the block. And when she drags me, I put her back in the house. Um, Nothing needs to be extreme.
No, I
And
agree
and
with
this is
that.
what I try to tell people: when you were 30 or you were a kid and you were playing football in high school, right? And then all of a sudden you feel like a has-been because you're in your 20s and your 30s, and of course you're not going to play football like that again. First of all, when we were teenagers, I grew up in the 70s, football was abusive. The coaches, they don't do that to kids anymore. It's not appropriate. It's not appropriate for the body. It's not appropriate for the mind. Now it's all about mind-body connection and keeping the body calm. So you're asking such a beautiful, and it's a big topic. At what age do you come to that? You come to that when you realize calming your body down, being gentle, going for a walk with a friend. That's the best exercise that you can get, rather than saying, how many reps did I do? Did I run enough miles? Did I get my heart rate up exactly to where it was supposed to be today? To which zone I'm going to be training in?
Yep.
Just make every bit of movement enjoyable, and preferably find somebody to enjoy it with. I always say to my husband, we work at home now. This is a post-pandemic problem or wonderful thing, however you want to look at it. Honey, you have a few minutes? Let's go for a walk. He says, okay, in between calls, let's go. Sometimes we just loop the backyard. We
Yep.
just want to get up and get out and
That's
get
it.
some fresh air. And when it's raining or when it's cold, we'll go do something indoors. But it's just that little hit, that little tidbit that I call, one of my books I open up, I call it bite-sized solutions. Just
Love
that
it.
little bit of something that, uh, and same with food. You want to have a cookie, take a bite of the cookie or share it with someone. They're tiny little things that make all the difference in the world. But I really, really like to see that older adults, if I can use that term, are adopting that it's
Too.
okay. It's okay to
And
be a couple of pounds overweight. It's okay to have gray hair. Just be where you are and find every way imaginable that you can, to enjoy it. Dow, this is just so much. Wonderful. Thank you for joining me today. It's a conversation that needs to keep going, and I'd love to have you back at some point. If you
thank
want
you.
to reach out to Dow Stick and are looking for advice on how to write about and portray older adults in the media, you can contact her at www.nursewriterdow.com, and we will post that on the show link. Dow, lastly, in closing, this has been so wonderful. And I want to ask you, what do you like about getting older?
Thanks, Patricia. I think what you just alluded to is choosing not avoiding my own inner voice, choosing what works for me and
Mhm.
feeling absolutely okay with it, no matter what other people, even my peer group, are
Mhm.
doing.
Mhm.
And also really valuing the quiet, um, and connections with other people. It's so much more meaningful, the one-on-one experiences, than having to go out and have something to tell people that I did. You know,
Yeah.
I'm not interested in that as much anymore.
Right. Right. Yeah, there's no, puffing up your chest and saying, "Look what I did." It's just you're okay with it. Yep.
Yeah, unless it's something that I came upon because it was a
Yeah.
passion of mine and
Mhm.
wanted to share it. It's not just so people think that I did something. It's that FOMO, fear of missing
Yes.
out. You
Yes.
go
Yeah.
out and do something that you're not even sure you want to do just so
Yeah.
you can say you did it. I'm not
Exactly.
into that anymore.
Exactly. Good for you. Dow, wonderful to talk to you. I hope to have you back on again. There's so much more to talk about. We'll schedule that at some point.
Thank you.
Thank you all for listening. Please subscribe to my channel here on YouTube for our engaging discussions on all things aging well. And for feedback and topic requests, you can contact me at www.patriciagreenberg.com. Thank you all for listening, and stay well and stay safe.